Colleen Montag, and this is my cardiac respiratory video. So first, I'm going to introduce myself to the patient when I walk in. Hi, I'm Colleen, and I'll be your RN today. How are you doing, Mr. Montag?
Pretty good, pretty good.
Awesome. Can I go ahead and look at your armband and please tell me your name and date of birth?
Justin Montag, October 8, 1991.
Perfect. Thank you so much. So recently, have you had any, chest pain?
Nope.
Heart palpitations?
Nope.
Do you bruise or bleed easily?
Nope.
Are you on any anticoagulants?
Nope.
Awesome. Have you had any troubles breathing?
Nope.
Do you get tired on exertion?
Nope.
Okay. So that is very normal findings. Next, is it okay if I go ahead and do a cardiac and a respiratory assessment on you?
Absolutely, go ahead.
Awesome. So first, I'm going to check his capillary refill. So they were both 2 seconds, so they're less than 3, and they were equal bilaterally. Next, I'm going to check his radial pulse. They're regular and equal bilaterally. Next, I'm going to show you where the popliteal and the posterior tibial peripheral pulses are. So the popliteal you'll find behind the knee right here. The posterior tibial is going to be back here on the side of the ankle on the inside. And then the dorsalis pedis is going to be on the shoe or on the top of the foot. And that's where I would check the peripheral pulses. Next, I'm going to listen to his heart sounds and his lung sounds. Is it okay if I do this?
Yeah, absolutely.
First, I'm going to just listen to your heart, okay? So you just breathe normal. And I'm starting at the aortic valve. Next, I'm going to go to the pulmonic. Herb's point. Then tricuspid. And then the mitral valve, also known as the apex. There were no extra sounds heard. I heard S1 and S2 and everywhere. Next, I'm going to check for jugular vein distension. So I would take my patient's head of the bed and I would take it down to 30 degrees. And then I would look for any distension after I turned their head just slightly. It would be right around here that I would see that. There is no jugular distension on this patient. Thank you so much. Next, I'm going to be listening to the bronchial sounds, which is on the trachea. So I'm just going to touch your neck and listen. Next, I'm going to listen for bronchial vesicular sounds. Next, I'm just going to check the rest of his respiratory pattern, listening for vesicular sounds. Now I'm going to do the back. So I'm going to start at the top and zigzag my way down. Can you turn your chair just slightly to your left? their normal sounds is equal bilaterally. The respiratory pattern is consistent and regular. Next, I would document all of the vital signs that I took, as his blood pressure, 130/75, his oxygen saturation, which was 99%, his heart rate, which was 65, his capillary refill, and the fact that I heard S1 and S2 sounds with no S3 or S4 sounds, murmurs, or gallops. I would check his radial pulse against his apical pulse, and those were equal. Next, I'm going to check for pitting edema. There's no pitting edema, and that he has no respiratory symptoms, and that is everything for my cardiac video.